So now coming towards aphasia. So what is aphasia? Aphasia is a disorder that affects how you communicate. It can impact your speech as well as the way you write and understand both spoken and written languages. Aphasia usually happens suddenly after a stroke or a head injury, or might be caused by any lesion or any tumor in the areas which are associated with speech. So again, most of the time when we talk about aphasia, we usually talk about the Broca's motor aphasia or the Wernicke's sensory receptive aphasia. So in this type of aphasia, because I'm just telling you something that we commonly talk about first before going deeper into the subject. So in Broca's area, what we see when we have a patient, we see whether there is any influence, any effect to the fluency of his speech. If the patient is not fluent, then what we think about is the Broca's aphasia, in which the patient has difficulty in speech, in saying things, the motor component is affected, while the comprehension is intact. And if you see a patient who talks fluently but has any impairment in comprehension, whatever he says does not make any sense, then you think about the Wernicke's aphasia. Again, I want to tell you that in both of these aphasias, repetition of words is also impaired. And that differentiates them from the transcortical type of aphasias, where repetition is possible. So, and these transcortical aphasias are produced by injuries to or from the many connections that integrate the language area. So, if the repetition is, intact, then you have to think about whether these aphasias are transcortical or not transcortical. So if there is a motor aphasia, we think about Broca's aphasia. If repetition is impaired, and if it is not impaired, then it would be called as the transcortical motor aphasia. Similarly, if the patient has fluent speech but comprehension is impaired, and if the repetition is also impaired, then think about Wernicke's aphasia. And if it is not impaired, then think about transcortical sensory aphasia. There is another type of aphasia which is quite severe, in which both the patient's fluency and comprehension are impaired, and repetition is also impaired. That means that all the three components which we have considered in aphasia, that is fluency, comprehension, and repetition, if all of these components are affected, then it is a global aphasia because all three components are affected. And if fluency and comprehension are, affected, but repetition is intact, then think about mixed task particle aphasia. So repetition, if repetition is not affected, you need to think about consider it as a task particle aphasia, and other things. If fluency is affected, then obviously the motor component, motor type of aphasia is there. If comprehension is affected, it will be receptive type of aphasia. If repetition is impaired, then think about the Broca's or Wernicke's aphasia according to the motor, according to comprehension and fluency. Or if repetition is not impaired, then the transcortical type of aphasia will be there. There's also a very the sleaze form of aphasia, which is known as an anomic aphasia, where the patient have intact fluency and comprehension, and obviously there is repetition as well, but he cannot find the word. So if there is a word finding type of difficulty in anomic aphasia, and when we go into certain part of the brain, there is not a very well defined area to denote anomic aphasia, like in Wernicke's and Broca's aphasia, where we have this Broca's area, a damage to that area leads to Broca's aphasia, or the Wernicke's area, damage to Wernicke's area lead to Wernicke's aphasia. But in case of anomic aphasia or the word finding aphasia, usually there's a huge region around the perisylvian area that can lead to this type of aphasia. So I think that this explanation makes it easier for you to have a good insight into the type of aphasia. So this is the same thing in this form of a table. In Wernicke's aphasia, the comprehension is impaired, the repetition is impaired, the naming is impaired, the fluency is preserved or even increased. In Broca's aphasia, comprehension is preserved except for grammar, and sometimes the repetition is impaired, naming is impaired, fluency is decreased. And in global aphasia, you can see everything is being impaired. In conduction aphasia, There is only impairment of this sort of naming. I also tell you that in Wernicke's aphasia, there is difficulty in understanding the spoken languages and also in reading and writing. So there are distinct cortical areas associated with native and second languages. This is something of importance when you are operating around these regions. In insular lobe, if you just consider it separately, it is